You know, that incredibly specific, almost universal ritual of going to the doctor.
Oh, yeah, the fluorescent lighting.
Right. You
Yeah.
walk into this room, you sit in a chair that's somehow like both stiff and squeaky at the same time.
Usually while you're thumbing through a lifestyle magazine from, what, 3 years ago?
Exactly. And eventually, your name is called. They escort you to a smaller, definitely colder room.
Yeah.
You sit on that table, covered in the crinkly paper.
And then you wait another 15, maybe 20 minutes.
Yeah, and finally the doctor just rushes in.
Yeah.
Right. They look over a chart for maybe 30 seconds, ask you a handful of questions, and then boom, they give you a snapshot diagnosis.
Which is, I mean, an opinion based entirely on this tiny 15-minute window of your life, a window that happens maybe once a year.
It's crazy when you think about it.
It's the absolute definition of episodic care. The entire medical establishment is basically built around these discrete, isolated events.
Yeah.
That 15-minute window is completely disconnected from the thousands of hours you actually live between those visits. You know, what you ate, how you slept, how your heart rate fluctuated, all of that context is just lost.
It's lost completely.
Because the system is fundamentally reactive. You only go in when something is already broken.
But okay, what if that doctor wasn't a harried human you saw once a year? What if your primary care physician was like an intelligence that just lived in your pocket?
24/7 monitoring.
Exactly. Checking your blood pressure, your sleep architecture, and actually custom manufacturing your medicine based on your daily biological data. I mean,
Wow.
it sounds like something straight out of a sci-fi novel.
It really does, but it is actively being built right now.
And that brings us to our mission today. We're taking a massive deep dive into the Q1 2026 earnings call for HIMS and HERS. And we're using the transcript provided by the YouTube channel Stock Diary 1.
Which is a great source. And
Wow.
for anyone listening who might think, an earnings call sounds like the driest possible material.
I mean, they usually are.
Right, but it is vital to reframe how you look at these documents. People assume earnings calls are just, well, financial housekeeping, just executives reading spreadsheets to appease Wall Street analysts.
Yeah, checking the boxes.
But if you know how to read between the lines, earnings calls are where the actual blueprints of our future are laid out. They strip away all the glossy marketing campaigns and reveal exactly where a massive corporation is deploying its capital.
And capital deployment is the clearest signal of where the smartest people in the room believe the world is heading, right?
Exactly.
Okay, let's unpack this. Because we are looking at a digital health platform that is actively attempting just a monumental transformation.
Total pivot.
Yeah, they're trying to evolve from what we conventionally think of as a telehealth provider. The place you go to quickly get a generic prescription online,
Right.
into a fully AI-powered, vertically integrated health behemoth. So the goal today is to give you an absolute insider's view of consumer healthcare, wellness, and the pharmaceutical supply chain.
By the end of this deep dive, you're going to see exactly how your own daily health management is going to look in the next few years.
Which is wild. So where do we start?
The shift they are proposing is profound. They are laying the groundwork to move global healthcare from a system of acute intervention to a system of continuous, personalized curation. And the blueprint starts from the very first moment a patient interacts with their platform.
Any intake.
Right. It starts with artificial intelligence.
Okay, so that first touch point is increasingly not a human intake nurse.
Yeah.
The company leadership revealed that they recently launched something called a Labs AI agent.
Alongside an upcoming weight loss companion, yeah.
Right. But the long-term vision they outlined, it completely breaks away from how most of us understand AI right now. They aren't just building one giant omniscient AI brain like a ChatGPT that tries to do everything all at once.
No, that would be too monolithic.
Yeah, they are building what they call a multi-agent model. What does that actually mean in practice?
The multi-agent architecture is a critical evolution in how we deploy artificial intelligence, especially in high-stakes environments like healthcare.
Okay.
Instead of a single model that tries to diagnose you, bill you, and comfort you all at once, a multi-agent system uses highly specialized, distinct AI agents that communicate with each other. The transcript explicitly details how this works.
So it's like a team.
Exactly.
Hmm.
First, you have an agent dedicated purely to intake, making the initial onboarding dynamic and conversational. It extracts the right symptoms and your medical history.
Just getting the baseline.
Right. Then, that agent hands the data off to an entirely different set of agents designed for clinical decision support. They specifically name a proprietary tool called MedMax for this step.
And then next.
And finally, there is yet another set of agents dedicated to ongoing daily care and adherence support.
Wow. So it's literally like having an entire concierge medical team in your pocket. You've got the intake nurse who asks how you're feeling, then the brilliant diagnostician in the back room crunching your numbers.
Working quietly in the background.
Yeah. And then the daily physical therapist or nutritionist who texts you every morning to make sure you're staying on track.
Yeah.
And all of them are digitized, communicating flawlessly with each other, and available 24/7.
That analogy is spot on.
Yeah.
And building an ecosystem like that requires an immense amount of technical firepower.
How about?
The leadership noted on the call that they're seeing a massive influx of top-tier tech talent joining the company specifically to build this out.
Which makes sense.
Right, but think about the current tech landscape. Why are elite machine learning engineers and AI specialists leaving the massive, prestigious Silicon Valley tech giants to work for a consumer healthcare platform?
That is a good question.
The executives answered that directly. It's the massive scale, the unique proprietary data, their existing infrastructure, and deep customer trust. They are offering engineers the ultimate playground.
Wait, let me stop you there.
Yeah.
Because if I'm listening to this right now, my skepticism is flaring up big time.
Yeah.
Like conversational intake and AI companions. They sound amazing in a corporate press release, right? But is this actually revolutionary, or is it just a glorified Google form wrapped in a friendly chatbot?
It's a fair question.
I mean, how is this any different from an automated text message saying, hey, don't forget to drink water and take your vitamins today? Where is the actual clinical weight here?
What's fascinating here is the underlying mechanism of how these models learn and compound their knowledge. This is what elevates it light years beyond a simple chatbot.
Okay, I'm listening.
It all comes down to network effects and clinical data. Let's look at the traditional clinic model we talked about earlier. If a human doctor sees a patient and observes a highly nuanced, rare side effect from a specific medication dosage.
That knowledge basically just stays locked inside that doctor's head, right?
Exactly. Maybe, if we're lucky, they publish a paper or mention it at a medical conference a year later. But in this multi-agent AI model, every single patient who uses the system instantly makes the AI smarter for the very next patient. The transcript highlights this beautifully with what the leadership refers to as the 1,000 second opinions concept.
Yes, I highlighted that exact quote when I was reading the transcript. 1,000 opinions at the same time. I really need to understand the mechanics of that because the implications are kind of mind-bending.
It represents the shift from isolated anecdotal medicine to hyper-personalized, data-aggregated care. The company has spent the last 9 to 10 years aggregating holistic patient experience data.
We're talking millions of interactions.
Millions. Prescribed outcomes, microdosage adjustments, and self-reported symptom logs. When you interact with this AI, say you report a mild headache after taking a new medication, it isn't just cross-referencing a static medical textbook.
It's not just Googling your symptoms.
No, it is instantly comparing your specific demographic profile, your weight, your age, your exact symptoms, against millions of historical data points from people just like you. It is as if the moment you report a symptom, 1,000 doctors who have successfully treated that exact same highly specific presentation all confer in a split second. And then they offer a unified consensus recommendation to your actual human provider.
So this MedMac tool isn't just a database. It's an evolving intelligence. The network effect means the product fundamentally improves its clinical accuracy simply by having more people use it.
That's the beauty of it.
Like if 10,000 users in the Pacific Northwest start reporting a specific, subtle reaction to a certain generic medication during allergy season, the AI recognizes that localized pattern instantly.
Immediately.
Whereas a decentralized network of human doctors across different hospital systems, they might take years to spot that trend, if they ever spot it at all.
Precisely. And the executive team stressed that this capability allows for remarkably faster clinical responses and highly tailored personalized dosing recommendations.
Which is huge.
But it is crucial to note that they aren't claiming the AI replaces the clinical decision maker. It supercharges them.
Right. The doctor's still there.
Yes. By taking the immense heavy lifting of data analysis and pattern recognition off the human provider's plate, the human clinician can actually focus their limited time on empathy, complex nuance, and the final clinical judgment.
It completely flips the script on patient engagement. The transcript actually mentions handheld engagement experiences post-original consultation.
The follow-through.
Exactly. It's about nurturing the patient through the grueling milestones of a treatment plan. Think about a weight loss journey, you know? The AI agent is there daily, tracking your adherence,
And adherence is arguably the single biggest hurdle in modern medicine.
Oh, without a doubt. Millions of people get a life-changing prescription. They take it for 3 weeks, experience like mild nausea, and just quietly stop taking it without ever telling their doctor.
Medication non-adherence is a multi-billion-dollar crisis in global healthcare. It leads to massive downstream medical costs.
Right.
By deploying an AI agent that engages you daily, an agent that can instantly answer your micro questions like, I feel a little nauseous today, should I skip my dose or take it with food? You prevent the patient from abandoning the treatment entirely.
Because they feel supported.
Exactly. The transcript explicitly notes that the expected outcome of this continuous microengagement model is much higher long-term retention and significantly better clinical outcomes.
But, having an AI concierge checking in on you daily, it highlights a really obvious blind spot.
Which is?
If the AI is relying on me to open the app and type in, hey, I feel great today, it's inherently flawed. Human beings are terrible narrators of our own biology.
Oh, absolutely.
We lie to our doctors about how much we drink. We lie to our dentists about flossing.
Everyone lies about flossing.
And we will absolutely lie to an AI about what we ate for breakfast. So how does this multi-agent system get actual objective physiological data if it can't run a lab test every single morning?
Well, it turns out solving that exact hardware problem is their next massive play.
Okay, let's get into that.
Because that data pipeline is the crucial bridge between a smart algorithm and actual healthcare. As you pointed out, subjective self-reporting is notoriously unreliable.
Garbage in, garbage out.
Exactly. To truly power a hyper-personalized AI that acts as your daily doctor, you need continuous objective physiological data. The transcript makes it explicitly clear that the leadership views hardware and wearables not just as fun fitness accessories, but as vital, non-negotiable data sources required to fuel their entire high-touch care model.
Their strategy here is fascinating, though, because they aren't locking themselves into a single ecosystem. Like when the analyst asked if they plan to build their own hardware or partner with massive existing players like Apple or Garmin.
The executive response was essentially an aggressive both.
Both, yeah. They are building proprietary devices, but they are also building universal integrations for the devices people already have on their wrists.
It is a highly pragmatic engineering and business strategy. From an engineering standpoint, integrating with third-party devices, the Apple Watches, the Oura Rings, the Whoop straps, allows the platform to instantly tap into a massive installed base of hardware.
The devices are already out there.
Consumers have already spent hundreds of their own dollars on these sensors. If a patient is already wearing a device that generates high-fidelity heart rate variability, sleep architecture, and daily activity data,
it is a strategic no-brainer to build the API bridges necessary to pull that continuous data stream directly into the multi-agent AI system we just discussed.
Right.
It's basically a bring-your-own-device policy for your biology.
Yeah.
If you've got the tech, they'll plug it right into your medical profile.
It's a great way to put it.
But here is the multi-million-dollar question. Hardware is a notoriously brutal business. The supply chains are a nightmare, manufacturing yields are tough, margins are incredibly thin.
And you are competing against giants like Apple, who have bottomless research budgets.
Exactly. Why on earth would a digital telehealth company take on the massive headache of manufacturing their own physical hardware? They described wanting to build devices that are easily worn, easily charged, and track basic metrics. Why even bother?
It all comes down to removing the barrier to entry and democratizing the data collection. Yes, an Apple Watch is an incredible piece of technology, but it also costs $400.
Which is a lot for a lot of people.
That price point immediately locks a massive segment of the population out of this proactive care model. The transcript reveals a very specific, aggressive strategy regarding their proprietary hardware. They aim to deliver these devices at cost.
At cost, meaning they don't make a single penny of profit on the physical device itself.
Correct. They plan to bake the cost of the hardware into their various subscription membership tiers.
Wow.
By providing a proprietary wearable at cost, they are completely removing the financial friction of health tracking. They are shifting the paradigm of hardware from a luxury consumer tech purchase into an integrated essential utility for managing your health.
So it's not a profit center at all.
It operates as a loss leader, or at worst, a break-even proposition, explicitly designed to feed the ultimate economic engine: long-term platform subscription and superior clinical outcomes.
That is brilliant. If the AI needs a continuous stream of data to keep me healthy, and keeping me healthy keeps me paying my monthly subscription fee for the next decade, then handing me a $30 tracking bracelet for free is like the highest ROI investment they could possibly make.
It absolutely is.
And they aren't just theorizing about this either. They are already executing a physical version of this philosophy right now. The transcript highlights their bio at-home blood testing device.
The at-home blood testing initiative is the perfect parallel to the wearable strategy. They looked at the traditional diagnostic pipeline and realized that sending people to a physical diagnostic lab introduces massive friction.
Nobody likes doing it.
Right. To get blood drawn, a patient has to take time off work, make an appointment, drive to a clinic, sit in another waiting room, and get stuck with a needle.
It's an awful experience.
A huge percentage of patients simply refuse to do it, which means the doctor never gets the data. By engineering world-class, frictionless hardware experiences for the home, whether that is a continuous wearable tracker or an episodic microneedle blood test, they capture critical biological data that simply would not exist in the traditional system.
So let's connect this back to the AI brain. If MedMax has my 10-year medical history, my self-reported daily symptoms, my real-time heart rate variability from my wearable, and my exact biomarker levels from an at-home blood test.
It's unprecedented visibility.
That is the 1,000-second opinions on absolute steroids. We're talking about entirely shifting the paradigm from reactive care, waiting until I feel terrible to finally go see a doctor, to truly proactive care.
Yes.
Like, the platform might notice a subtle degradation in my sleep architecture combined with a slight elevation in a blood biomarker and identify an impending health issue before I ever feel a single symptom.
That is the holy grail of modern medicine. And it is mathematically impossible without a continuous, multivariate data stream.
Because humans just can't track all those variables at once.
Exactly. It completely alters the fundamental relationship between doctor and patient. Your healthcare provider is no longer a detective trying to solve a mystery when you show up sick.
Right.
They are an air traffic controller, monitoring a real-time dashboard of your biology and making micro-adjustments to your lifestyle or medications to keep all your metrics in the green.
But gathering all this incredible data, having the smartest AI in the world, and knowing exactly what is wrong with me, well, that's all still just the digital side of the equation.
It's just information, yes.
Exactly. It's just information. Eventually, proactive care requires a physical intervention. You have to actually put a treatment into the patient's body.
The nuts and bolts of medicine.
And that introduces the massive heavy lifting physical investments this company is making, which goes far beyond software. So let's talk about the supply chain, specifically what they are doing with peptides and longevity treatments.
This is where the elegant digital strategy collides with the cold, hard, incredibly complex reality of physical pharmaceutical manufacturing.
It's not just an app anymore.
No, it's real-world infrastructure. The transcript dedicates a massive amount of the Q&A to the developing opportunity in what are called peptides.
Right.
To give the listeners some crucial context, the pharmaceutical market over the last few years has been entirely consumed by the explosion of GLP-1 weight loss drugs, things like Ozempic and Wegovy.
You literally can't escape the headlines about them.
Exactly. But the leadership on this call is looking miles beyond that initial wave. They see a massive untapped demand extending into a much broader category of peptides and longevity-focused preventative treatments.
Right. And for anyone listening who isn't, deep into biochemistry, a peptide is essentially a short chain of amino acids. They act as highly specific signaling molecules in the body, telling your cells to perform certain functions.
Like little biological text messages.
Exactly. GLP-1s are just one type of peptide, but there are hundreds of others currently being researched for everything from accelerated muscle recovery to cognitive enhancement to cellular anti-aging.
The potential is massive.
The company views this as the next massive tsunami in consumer health. But to support this wave, they aren't just writing digital prescriptions and hoping your local corner pharmacy has the inventory.
No, they are building the factory.
The transcript reveals they are leveraging a 1 million square foot 503A compounding footprint, 1 million square feet.
To truly grasp the scale and strategic importance of that number, we have to explain what 503A compounding actually is.
Please do, because it sounds incredibly niche.
In the United States, traditional retail pharmacies dispense mass-manufactured, FDA-approved drugs in fixed standard doses, say 5 milligrams, 10 milligrams, or 20 milligrams.
The standard blister packs.
Right. A 503A compounding pharmacy, however, operates under a different set of FDA regulations. They are authorized to create custom, bespoke medications tailored to the exact, specific needs of an individual patient based on a doctor's prescription.
And mixed for you.
Exactly. By building 1 million square feet of this specialized infrastructure, they are taking the concept of hyper-personalized digital medicine we just discussed with the AI and manifesting it in the physical world at a staggering industrial scale.
But here's where it gets really interesting. It's not just about mixing the final medication in a sterile room. The transcript notes that late last year, they actually acquired a peptide API manufacturing facility.
That's the real game changer.
Their goal is to fully verticalize their U.S. supply chain. API stands for active pharmaceutical ingredient. That means they aren't just buying the raw chemical ingredients from overseas brokers and mixing them here.
No.
They are actually synthesizing the core chemical compounds themselves on U.S. soil.
If we connect this to the bigger picture of global healthcare, owning the API facility is a monumental strategic moat. The global pharmaceutical supply chain is incredibly fragile and, honestly, highly fragmented.
We saw that during the pandemic.
We have all seen the massive, frustrating shortages of critical medications over the last few years, largely because so much of the world's API manufacturing is concentrated in just a few overseas markets.
Right.
By bringing the complex chemical synthesis domestic, they certainly control their profit margins, but more importantly, they control the absolute reliability of their supply. When competitors run out of stock because a cargo ship is delayed, this platform will still be printing medication.
And the quality control. The CEO on the call was incredibly explicit about this. He contrasted their end-to-end domestic control with what is happening in the gray market.
Oh, the gray market is a nightmare.
Now, the gray market for these advanced peptides right now is the absolute Wild West. Because of the incredible demand and the massive shortages of branded drugs, you have people buying research-grade chemicals online. They're mixing them with bacteriostatic water in their kitchens or going to highly unregulated strip mall med spas.
It is terrifying.
It is. You are injecting a biological signaling molecule into your body, and in the gray market, the risk of bacterial contamination, rapid peptide degradation, or just flat out getting the wrong amino acid sequence is astronomical. It's like buying sushi out of the trunk of a car.
That's a very vivid analogy, but it's accurate that the danger cannot be overstated. Peptides are highly sensitive molecules. They require strict temperature controls and absolute sterility.
Right.
When you are bypassing traditional pharmacies, transparency and purity are non-negotiable. The leadership correctly points out that a safe, validated supply chain combined with first-class physician oversight simply does not exist in the gray market today.
It's all just blind trust in an anonymous website.
Exactly. By owning the process end-to-end from the actual chemical creation in the API facility to the sterile compounding in the 503A facility to the digital prescription from the MedMax AI, they are building an impenetrable fortress of brand trust.
Which is hard to copy.
They noted on the call that this infrastructure will be incredibly difficult and wildly expensive for any telehealth competitor to match.
But there's a massive tension discussed in the Q&A regarding timelines and FDA regulations.
Yes, the regulatory waiting game.
The transcript mentions they're waiting for regulatory clarity in late July regarding certain peptides moving to FDA Category 1, with more definitive information expected by the end of the year.
Right.
So they are pouring hundreds of millions of dollars into this massive physical infrastructure. But they are technically waiting on the regulatory green light to fully unleash it. And when the analysts pushed them on this delay, the leadership stated their strategic philosophy is not necessarily first, but best.
Yes, that was a very deliberate, highly calibrated phrasing by the executives. Not necessarily first, but best.
I have to ask the hard question here, though. In a hyper-competitive market, where every single telehealth startup, weight loss clinic, and med spa is trying to violently grab market share during this peptide boom right now.
It's a gold rush.
It is. Isn't being late to market a massive, potentially fatal risk? If you sit on your hands waiting for the FDA to meticulously categorize every compound while your competitors are happily operating in the gray areas and signing up thousands of patients, don't you lose the land grab entirely?
It is a risk, but it is a highly calculated one based on institutional longevity. What's fascinating here is how the executive team views the regulatory landscape. They don't see the FDA as an obstacle, they see it as a filter.
Interesting.
They explicitly stated on the call that their primary focus is building clinical protocols that are absolutely bulletproof. In consumer software, the classic Silicon Valley mantra is move fast and break things.
Right.
In consumer healthcare, if you move fast and break things, people die.
Yeah, that's a very different stakes game.
A single safety incident caused by a tainted gray market supply chain can cause a company's entire reputation and their valuation to evaporate overnight.
You can't beta test a chemical injection.
Exactly. By waiting to be best, they ensure they have total data transparency, validated internal manufacturing yields, and absolute regulatory compliance.
Will be the long game.
When the market matures and the FDA eventually drops the hammer on the unregulated gray market, which is historically inevitable, the companies that cut corners to get to market first will be wiped out by injunctions.
Oh, wow.
Meanwhile, the platform sitting on 1 million square feet of fully compliant domestic infrastructure and bulletproof clinical protocols will simply absorb all of that newly orphaned market share.
It's the tortoise and the hare, but the tortoise owns a 1 million square foot domestic API synthesis facility.
A very well-armed tortoise.
And going back to the AI ecosystem for a second, the transcript explicitly links this physical compounding capability back to the digital multi-agent model.
How so?
Because they control the compounding footprint, they can support truly individualized dosing. So the MedMax AI analyzes your continuous wearable data, cross-references your at-home blood test, and realizes your specific metabolic biology needs exactly 2.4 milligrams of a peptide compound.
Not the mass market, one-size-fits-all 5-milligram dose.
Exactly. The digital system pings the compounding facility, and they custom-make that exact 2.4 milligram dose just for you. It is the physical manifestation of hyper-personalized data.
It is a closed, self-reinforcing loop. The hardware gathers the objective data, the AI processes that data into a highly specific clinical recommendation, and the verticalized physical supply chain manufactures the bespoke cure.
Okay, so controlling the supply chain is incredible. Building the multi-agent AI is incredible. But we're ultimately analyzing an earnings call transcript, which means we have to talk about the financial engine driving this entire machine.
The numbers have to make sense.
How does this core business fundamentally shift how it acquires customers, and how does that translate to the bottom line?
Yeah.
Because there is a massive pivot occurring right now on their platform regarding branded drugs.
There is, and it requires a close reading of the financial Q&A section to fully grasp the mechanics of what they are doing. While they are building out the massive compounding infrastructure for the future of custom peptides, in the immediate present, the company is executing a massive strategic pivot toward branded products.
Right.
They specifically noted ongoing conversations and expanding partnerships with Novo Nordisk, the pharmaceutical giant behind the GLP-1 drugs Wegovy and Ozempic.
And the results of this branded pivot are staggering.
Yeah.
The transcript reveals that almost all of your new business right now is coming in on the branded
The
side.
volume is huge.
They reported a volume spike of north of 100,000 new users, specifically coming to the platform for these branded treatments. The leadership pointed out that this influx surpasses their biggest historic, highly engineered seasonal campaigns.
By a wide margin.
It brought in more users than their massive New Year's resolutions marketing push and bigger volumes than their Super Bowl ad campaigns. That is a tsunami of organic consumer demand.
It is a testament to the incredible power of combining a globally recognized, highly desired branded pharmaceutical with a frictionless digital intake and distribution platform. The consumer already wants the drug, the platform just removes the friction of getting it.
Right.
However, the Wall Street analysts on the call were very keen to understand the underlying financial mechanics of this shift. Because selling a branded product manufactured by another company, where you have to buy the inventory at wholesale prices, has a very different margin profile than selling a custom compounded product that you mix yourself in your own facility.
Right. So let's break down the unit economics they discussed. The leadership stated that compounded and branded products yield roughly comparable unit economics on a gross dollar basis.
Which is surprising.
Which sounds comforting, right? But there was a significant margin shift happening under the surface related to their shipping logistics.
Yes, the transition in their shipping cadence. Previously, for their customized compounded business, they shipped a 2-month supply of medication to the patient at a time.
Okay.
Now, with the vast majority of new consumers coming onto the platform for branded products, which often have different shelf life profiles or manufacturer restrictions, they are operating on a 1-month shipping cadence.
I look at this through the lens of consumer psychology. Shipping a 1-month supply is exactly like a monthly subscription box model.
Like a Birchbox for your health.
Exactly. Getting a physical package in the mail every single month keeps the platform's brand top of mind. It significantly increases the physical touch points you have with the patient. From a pure engagement and retention standpoint, it makes total sense. You never want the customer to forget about the platform for 60 straight days.
But financially?
Financially, the math is brutal. Shipping a cold storage package 12 times a year instead of 6 times a year essentially doubles your fulfillment labor and your postage costs.
Which is exactly why the company had to acknowledge on the call that this shipping transition presents some initial gap margin headwinds. The gross margins will take a slight, noticeable hit in the short term.
Which usually spooks investors.
It does. However, the executive team was incredibly focused on the long-term mathematical advantage of this shift, specifically regarding their EBITDA, earnings before interest, taxes, depreciation, and amortization. This is the core measure of their operational profitability.
Let me jump in here with a blunt financial question that I'm sure every analyst on that call was thinking.
Go for it.
If shifting your entire new user base to branded products, combined with a 1-month shipping cadence, actively hurts your gross margins right now because of shipping costs, why was the leadership so incredibly confident?
It seems counterintuitive.
In fact, they used this exact call to take their overall revenue guidance up for the rest of the year. How does a lower initial gross margin equal higher confidence in annual revenue?
It all comes down to the mechanics of cohort stacking and the lifetime value of the patient. Let's break down the math. If you bring in a massive cohort of 100,000 new users in a single month because of a branded drug, and they are on a 1-month shipping cadence, they are paying their subscription fee again the very next month. The revenue compounds much faster.
Because there's no 2-month gap.
Exactly. The transcript notes that as you start to stack these massive cohorts each month rather than each quarter, you inherently get a massive benefit on EBITDA as those consumers return. The sheer volume of returning, compounding monthly revenue completely overwhelms the slight dip in individual shipping margins.
Sort of volume play, pure and simple.
It is a volume and retention play. Furthermore, the executive leadership breaks down the specific market inefficiencies they are exploiting to drive this financial confidence. It isn't just about selling weight loss drugs.
What else is it?
It's about cross-selling across the entire platform. They noted that as they broaden the number of medical specialties available, specifically mentioning robust categories like menopause, testosterone therapy, and advanced diagnostics, they are able to draw interest from these new, massive weight loss cohorts into other treatments. Oh, I see.
The customer comes in through the front door for the highly publicized branded weight loss drug. They experience the frictionless multi-agent AI intake. They build trust with the platform, and eventually they subscribe to a personalized dermatology cream or a compounded longevity peptide.
So they use a lower margin, high demand branded drug to acquire the customer once and then retain that customer across multiple lower cost, much higher margin specialized health categories for the next decade.
It's a classic land and expand strategy.
The transcript also mentions achieving G&A leverage in the back half of the year. Let's decode that for the listener, because that is the secret sauce of digital scaling. G&A stands for General and Administrative Expenses, right?
Yes. The fixed costs of running the corporate machine, paying the executive salaries, maintaining the software infrastructure, keeping the lights on at headquarters.
Okay. Understanding G&A leverage is the key to understanding why software-driven health platforms are valued so much higher than traditional hospital networks.
Yeah. Because a traditional brick-and-mortar hospital system has terrible leverage. If they want to add 1,000 new patients, they have to lease a new physical building, hire more receptionists, buy more waiting room chairs, and pay more electricity bills. Their costs scale linearly with their patients.
One for one.
But this digital platform's business model relies on making massive early G&A investments to build the infrastructure, spending millions coding the AI agents, and buying the million-square-foot compounding facility. But once that digital and physical infrastructure is built, it doesn't cost them twice as much money to serve 2 million patients as it does to serve 1 million.
The software scales infinitely.
Exactly.
Yeah.
So in the back half of the year, they expect to achieve massive G&A leverage because they will not need to proportionally increase those fixed corporate expenses, even as the revenue from cohort stacking skyrockets.
Right. They are aggressively prioritizing market share right now. They are willing to accept slightly lower shipping margins today to establish absolute dominance in a leadership position, banking on these massive economies of scale to generate a geyser of free cash flow later.
It is the exact playbook Amazon used to dominate retail. Build the absolute best, most frictionless infrastructure, capture millions of loyal users, become the default platform.
And then, once you are a daily habit in their lives, the economies of scale take over.
Which leads us to the final piece of the puzzle. Winning the domestic market is one thing, but how does this massive corporate infrastructure export to the rest of the world, and what is the ultimate end game?
The transcript reveals a very methodical, risk-averse approach to global expansion. They're using the massive United States market as their primary testing ground and sandbox.
Testing it out at home first.
Yes. New health categories, they specifically call out the rollouts for testosterone, menopause, and labs are being rigorously optimized in the U.S. for a period of 6 to 9 months.
That's a solid testing window.
During this window, they test the AI conversational agents to ensure they capture nuance, they refine the clinical prescribing protocols, and they stress test the physical supply chain to ensure it works seamlessly. Only after that optimization period is complete do they push these categories out to 5 or 6 critical international regions.
And they already have a significant foothold internationally to leverage. The transcript mentions international platforms like LiveWell and Zava that are operating under their corporate umbrella.
Yeah, they do.
And what's really interesting is that the leadership noted the international markets are actually uniquely primed for this massive shift toward branded weight loss drugs. Those international platforms have already been operating with branded pharma models for much longer than the U.S. side of the business.
Which is a huge advantage.
Right, meaning their relationships with the European manufacturers, their distribution logistics, and their regulatory pathways are already well established.
Yes, counterintuitively, the international rollout of these massive new branded categories might actually be smoother and faster because the operational precedent is already there.
But the international geographic strategy is really just a symptom of their ultimate goal.
Right. The most profound part of this entire earnings call transcript is how the leadership fundamentally defines what they actually want the company to become. They do not want to just be a digital clinic or a pharmacy.
Not at all.
They want to become the curator of high-quality everyday care and, most importantly, the primary front door for innovators.
The front door. I circled that phrase multiple times when I read the transcript. They revealed they are currently in 24 deep conversations with pharmaceutical companies, biotech firms, new medical device manufacturers, and advanced diagnostic companies.
A lot of partnerships brewing.
They specifically named partners like Grail, which is a company that does revolutionary early cancer detection through a single blood test, and Eucalyptus. So what does this actually mean in practice? Why does a brilliant biotech company that makes cutting-edge cancer diagnostics need to partner with a digital platform that got its start selling personalized hair loss and weight loss treatments?
This raises an incredibly important question about the fundamental bottleneck in modern medical innovation. The reality of global healthcare today is that brilliant scientists and engineers are inventing miraculous technologies at a breakneck pace.
The science is there.
It is. They are creating targeted biotech therapies that can alter the trajectory of rare diseases. They are creating advanced diagnostics, like the Grail test, that can detect multiple types of cancer from a single blood draw years before a tumor ever causes a symptom.
Which is mind-blowing.
But these innovators face a massive, often insurmountable hurdle: distribution.
They can invent the cure in a lab, but they can't figure out how to get it to the patient.
Exactly. The traditional medical establishment is agonizingly slow to adopt new technologies. For a new diagnostic test to reach the masses, the inventing company has to hire an army of sales reps to educate thousands of individual doctors one by one.
A logistical nightmare.
They have to navigate archaic, labyrinthine insurance reimbursement codes. And even if they do all that, they still have to hope that a primary care physician remembers to order this specific new test during that rushed 15-minute annual visit we talked about at the beginning of the show.
Right.
It is a distribution nightmare that actively stifles innovation, bankrupts biotech startups, and ultimately costs lives.
But I have to push back on the strategy. If this platform tries to be the front door, for literally everything from generic weight loss pills to menopause treatments to highly complex anxiety-inducing advanced diagnostics like a Grail cancer test, do they risk massively diluting their brand?
It's a valid concern.
Do they become a chaotic digital strip mall where everything is thrown at the wall instead of a curated, trusted medical experience?
That is the inherent risk of any massive horizontal expansion. But this is exactly where the multi-agent AI and the continuous data stream from the wearables become the critical glue that holds the entire brand experience together.
Okay, how so?
The platform doesn't just list a cancer diagnostic test on a digital menu and passively hope you decide to buy it. The multi-agent AI actively uses your continuous wearable data, your historical family history intake from the MedMax agent, and your previous biomarker levels to proactively recommend the Grail test exactly when it is statistically and biologically relevant for your specific profile.
Ah, I see. They aren't a storefront. They are the ultimate matchmaker.
They are the indispensable toll bridge of modern medicine. By owning the daily, high-touch relationship with millions of consumers, by having built the deep customer trust, and by possessing the massive geographic distribution footprint.
They become the gateway.
Yes, this digital platform becomes the single most efficient way for any medical innovator to reach the exact patients who need their product at scale. The leadership stated clearly on the call, innovators need distribution.
And they have it.
By positioning themselves as the front door, this platform captures the massive financial value of all future medical innovations without having to spend billions of dollars inventing the science themselves.
Let's bring this all back to you, the listener, because it is incredibly easy to get lost in the corporate strategy of million-square-foot facilities, API synthesis, and EBITDA leverage.
Very easy to lose the forest for the trees.
Right. What we have decoded today is nothing less than the infrastructure of your future health. We started with the idea of conversational AI companions, specialized multi-agents that live on your phone, check in on your adherence daily, and learn from the collective 1,000-second opinions of millions of other patients.
We moved to the physical data collection that feeds that AI brain. The strategy of providing at-cost wearables and frictionless at-home blood tests that transform your biology into a continuous, objective data stream.
Completely removing our historical reliance on episodic, reactive doctor visits.
Exactly.
And then we dug deep into the massive physical supply chains. The realization that digital data requires physical cures and how customized peptides and longevity treatments are being brought entirely in-house.
A fully verticalized, domestically controlled API and 503A compounding manufacturing process, ensuring absolute purity and exact dosing tailored precisely to what the AI says your biology needs.
And we ended with a financial and strategic endgame. The leveraging of highly desired branded pharmaceuticals to rapidly acquire massive, sticky cohorts of users, building an insurmountable scale and G&A leverage that allows them to become the ultimate front door for every major pharmaceutical and diagnostic breakthrough of the next decade.
Healthcare is shifting from a localized reactive burden to a global, data-driven, proactive lifestyle choice. The friction of the waiting room is being removed. Your phone is becoming your primary clinic.
And that leaves us with a lingering, somewhat provocative thought for you to ponder. As this platform, and undoubtedly others that will try to copy this model, successfully aggregate real-time biological data from millions of users and process it through thousands of AI second opinions.
It changes everything.
We are rapidly approaching a reality where your digital health companion might predict a critical health event, a subtle heart arrhythmia, a metabolic shift, a cancer marker, years before a traditional human doctor ever could, and years before you feel a single physical symptom.
It is a statistical inevitability. The aggregated data will simply be too predictive to ignore.
So the next time you think back to that traditional doctor's waiting room, sitting on that crinkly paper, waiting for someone to finally tell you what is wrong with you, imagine a near future where the front door to your healthcare actually knows more about your future than you do.
It's a wild thought.
When your phone tells you that you are getting sick before your own body does, how does that fundamentally change your relationship with your own biology? It is a massive paradigm shift, and it is already under construction. Thank you so much for joining us on this deep dive. Take care.